Hello. My name is Charles, and I'm here to tell you about spondylolistheis and spondylolysis. There are many reasons why we have back pain. One of the most common reasons is discussed here. As long as the vertebrae are in a nice, straight line from each other, for sure, there is not much pain experienced by the person. However, if the lumbar vertebrae are misplaced forward, and there is a little square space on the bottom of the vertebrae, this condition is what we call spondylolisthesis. Since it is a long name, it is now commonly termed as spondy. Spondylolisthesis is instability in the spine that may cause severe back and leg pain. Spondylolisthesis is coined in 1854 from the Greek language spondylo, for vertebrae, and listhesis, for slip. This condition describes the displacement of a vertebral body in relation to the vertebrae below. It was first described in 1782 by a Belgian obstetrician, Dr. Herbie Noz. He reported a prominent bone in front of the sacrum that obstructed the vagina of a small number of patients. A spondy can happen at any of the vertebrae along our back. But the place between the fifth lumbar vertebrae and the sacrum is probably the most common. Lumbar interbody fusion. For patients with back pain, which is caused by spondy, the transfemoral lumbar interbody fusion lift may be an option. With this procedure, Dr. Pasmino is able to eliminate motion between painful vertebral bodies by using a bone graft material. Here, the main concept is that by eliminating painful motion, the pain is removed. When are fusions needed? Fusions are only needed in the following cases conditions. Treatment of a fractured vertebra. Correction of deformity, spinal curves or scoliosis. Correction of instability, meaning an abnormal or excessive motion between two or more vertebrae. Correction of the spondy itself. Treatment of some cervical disc herniations. Elimination of pain from painful motion. Treatment of recurrent disc herniations. How does pain come in the whole process? We have ligaments in the whole length of the spinal column, and normally, if the ligaments are in a straight line, there's usually not so much of a problem. However, as the fifth vertebrae, as it is placed forward, it stretches the ligaments. As a matter of fact, the more ligaments get stretched, the more pain we're going to run into.